Hi guys, welcome back to my channel. Dr. Nina here. So today I've got Charlotte with me. Her main concern is definitely her under eyes area. So she feels she's got really sunken and dark circles underneath her eyes. She said she had them since she ever remember. So what she wants to do, she wants to restore a bit of volume. She had fillers before. She thought it worked really well. So today I'm gonna assess her face and I'm gonna inject again some derma fillers just to restore the volume and just brighten our eyes again. So that's where the ligament goes across, and that these area here, there's a slight puffiness. So I have to be careful not to inject too much there, because the risk is that if I cross the ligament and the filler goes next to these area here, it can actually gives you more puffiness. Right. Yeah, so normally what I do, I just treat the under eyes by supporting the mid face. So the injection would be more lower down here. Yeah, right. So I can't go here, otherwise it just gives you eye bags and then very long-term complications. So yeah, it's just the way anatomically where your trough is. Yeah, we have to be careful, and we can't go exactly where it is.
Where are most people's troughs?
It's normally, so some people have a trough lower down because the ligament goes across here. So if you have a trough like here, it's easier to correct, basically. Yours is high, so I can't inject directly there because that's where the orbit starts. So I just have to be careful just to avoid long-term complication. Yeah, it's a bit tricky, but that's fine. Okay. Hi guys, I'm here with Charlotte today. So genetically she suffers from hollowness under the eyes, dark circles since she ever remembers. So what I'm noticing anatomically is that she has very thin skin. So the darkness is mainly due to the fact that she's got lots of capillaries that go underneath the skin. So for the darkness, there's not much we can do. However, because also there's some volume loss in the area, when the light hits the under eyes, just make it look darker. So what I'm going to do today, I'm just going to restore the volume loss with some hyaluronic acid filler in this area here to support her mid face. So her trough is quite high and she has a little bit of puffiness here, which is so common. So it means her lymphatic system is struggling to get rid of the fluids. So in those cases, because of these two situations, so a little bit of an eye bag and the trough is quite high, I have to be careful. I can't inject too high and not too much, otherwise I can actually give her more eye bags, or the hyaluronic acid can actually go into her eye globe. So we have more and more study about the under eyes filler, and the more we know, the more we are careful and conservative about it, because we have seen cases of permanent swelling under the eyes in people that had these conditions even 10-15 years down the line. I like to do this treatment in combination with the under eyes because it really goes and fills and lifts the whole mid face. So I always use a very safe cannula. Lovely. You okay, Shanna? Yeah, lovely. Just support. That's it. With a little tiny pressure. Well done. It's done with the cannula. So as you can see, the patient is very comfortable because the cannula is completely blunt. Just gonna change entry point. Let's push up again, sorry. There you go. Great. Okay. Okay, so now I'm just gonna do her cheeks. So the initial part when I do normally the cheekbones with fillers is just to support the inferior part of the cheeks, which is the apple of the cheek. So what I do, I just basically firmly hold her cheek, so she's gonna have a really nice lift. And then once I palpate it, I just do a tiny shell scratch. Well done, perfect. And then I'm gonna very slowly circle that. Okay, nice. Perfect. And then I'm gonna go with the cannula to do the rest. As I lift, I inject, so that just contours beautifully the upper cheekbones. So as you can see, the patient is comfortable, the cannula is long but it's completely blunt, so it's very, very gentle. Yeah, it looks so good. I'm so happy, I'm excited. So I'm gonna show you how everything looks.
It looks really, I'm really pleased.
Oh, I'm so happy, of course. So, and you're really swollen now, obviously, so when it just comes down, but you've got really nice curves again. So I'm just gonna massage everything thoroughly. But yeah, you've got a nice lift.
Brilliant, thank you.
My pleasure.
Oh, I'm really pleased.
I'm so happy to hear. You definitely don't look like back from Vegas. So I'm just gonna massage it, so bear with me. I'm gonna be quite firm, I apologize, but I like to make sure the filler settles really nicely. So you may have some swelling, okay, for the next 72 hours mainly. So don't panic if one side swells up more than the other one. Yeah, it is exactly the same amount. It's just the body may process the filler differently. So don't worry, everything will settle. So main aftercare after fillers for the next 48 hours, make sure you don't apply makeup. That's just to avoid potential infection, because obviously we went in with the needle a few times, so the entry point could get infected, so please just be super careful. The other thing I would say is no exercise again for a couple of days, just to prevent any further swelling, and no, don't drink alcohol, just take it easy for a few days. Oh my god, I'm excited, it looks really good. Perfect.